Good afternoon, and thank you for joining me. Today we're going to learn a little bit about chronic obstructive pulmonary disease, also known as COPD. Did you know that COPD causes airflow restriction, causing those affected by it to have a hard time taking a breath just while sitting in their lazy boy chair? COPD has affected many. Although it can be easily misdiagnosed as asthma, it is an irreversible disease. Today we're going to get a better understanding of the causes and treatments available for COPD. So what is COPD? The McGill's Medical Guide explains COPD as a progressive irreversible disease of the lungs that causes expiratory airflow obstruction. Those that suffer from COPD may have a difficult time laying flat on their back. They may have to prop themselves up for sleeping in an upright position by using pillows or sleeping in a chair. It also may cause heart disease due to the fact that there is a lack of airflow from the lungs to the heart. The most common form of COPD is a combination of chronic bronchitis and emphysema. COPD causes many issues in one's daily life. It can affect anything from physical activity to simply taking a shower. So what causes COPD, and how do you know what the symptoms are and if you have it? Well, like I said, COPD is a combination of chronic bronchitis and emphysema. One way to know if you have COPD or not is to take a pulmonary function test with your physician. A pulmonary function test gives the physician a better idea of what you may or may not have. A pulmonary function test also helps the physician convince if a patient is a smoker to quit smoking, as it progressively slows down the COPD disease. So what symptoms may you feel or may you notice if you may have COPD? Well, you will suffer from chronic cough and shortness of breath. Eventually, it may turn into wheezing, and it may need a greater effort exerted in order to just breathe. Misdiagnosis. Well, more than half of cases are misdiagnosis as patients just living with asthma. Unlike asthma, COPD can cause health to diminish the quality of life over time. About 51% of patients were later diagnosed with COPD reported to be initially diagnosed with just asthma. And then 37.9% of patients were previously diagnosed with reports of COPD, and only 10.6% of patients reportedly diagnosed with COPD were not initially diagnosed with COPD or asthma. A pulmonary function test can determine if the disease exists in a patient and help convince the patient to stop smoking. COPD may be misdiagnosed as asthma, and that would be why you would want to go ahead with the pulmonary function test. Now, what treatment and care is available for patients suffering with COPD? Here are just a few treatments and care plans. There is currently no cure for COPD, and it is irreversible. Smoking cessation slows down the decline of pulmonary function, and in order to stop smoking, physicians do suggest that you can use nicotine patches or nicotine gum to stop smoking. Pulmonary rehabilitation is another way to help a patient cope with COPD. It allows the patient to improve their physical endurance. Features of programs include education, goal setting, breathing and conditioning exercises, and psychosocial support. Another way to help patients with COPD is to have their regular flu vaccinations. They're going to want to do this between October and November every year. This helps to ward off life-threatening influenza and pneumonia. Also, a pneumococcal vaccination every 6 years helps to prevent against pneumonia-causing bacteria that can severely increase the rate of the COPD. A few ways to help deal with COPD include smoking cessation, pulmonary rehabilitation, and flu vaccine. In our time, we have discussed what COPD is, the causes and the symptoms, how it can be easily misdiagnosed as asthma, what treatments and cares are available. We have discussed how one may struggle with simply just trying to breathe while living with COPD. I would like to again thank you for your time and hope you have a wonderful day.